Dozens of nurses at San Francisco General Hospital came to City Hall today to deliver to Mayor Ed Lee 235 empty scrubs. They say the uniforms should be filled with new nurses. The biggest public hospital in San Francisco has been struggling with understaffing issues for months, and the nurses have been at the bargaining table with the city since February to negotiate a new contract. Today, they found the mayor's door closed. Norlissa Cooper, a registered nurse at SF General.
The city has saved $16.9 million in salary savings, while patients continue to fall, while people go unfed, while people sit in stool. This is how they feel about the people of this city. The door is locked. What does that say to us? Nurses that struggle every day to provide safe patient care. They don't care. They're not even here to address our concerns. Every Tuesday, they meet with the tech companies to see how they can better serve the tech companies and keep them here. This is completely absurd.
A representative took the scrubs and told the nurses she will give their message to the mayor. The nurses say the empty scrubs are a symbol of how unprepared SF General is for the implementation of the Affordable Health Care Act. They expect more and more low-income patients in the hospital and want to welcome them with the best care possible. Dave Fleming, a registered nurse at SF General and a member of SEIU 10-1, says understaffing is a chronic problem at the facility.
If the ward or the unit calls for 12 nurses, we get 9. And how can you do this job? This is the problem. The nurse is working her tail off, running around, trying to keep up with all the tasks that we have to do. And the most important factor of nursing is that we see the patient. This is what we do. It's the minute-to-minute care, the hour-to-hour care. We need to be able to see our patients. But if we're so tied up that we're just running around trying to get everything done because we don't have enough assisted help, how do we provide excellent care to the patient? And that's what it's about. It's about care excellence to me.
The death of Lynn Spalding, a 57-year-old patient found deceased in a stairwell last October at SF General, added to the emergency message that the nurses wanted to send. But Rachel Kagan, a spokesperson for SF General, says the hospital is aware of the situation, but does not feel it constitutes an emergency.
The timing of surfacing some of these grievances or complaints is likely connected to contract negotiations, and perhaps they are trying to put pressure on the bargaining table by having public events, which is certainly their right to do. It is a difficult job at times. It is stressful to work here, and so if nurses are experiencing that stress, I certainly can't argue.
Dan Murr, a registered nurse in the emergency department for 20 years, says not only is the city holding to a tough line on staffing and contract talks, but it's also refusing to spend money it's already allocated.
The mayor, in so many different ways, has engineered this hiring freeze, this soft hiring freeze, where they screwed up the hiring process, so we can't get people in the door. And then in addition, they won't budget for the people we need anyway. They won't fill the budget they have, and they won't budget for what we really need. So I think we're really tracking them down. We're calling them on their phony numbers, and we're going to keep them in the spotlight because we're building a brand new hospital. The taxpayers pointed up $800 million for a brand new hospital, and are we not going to be able to staff it? That's just wrong.
San Francisco Mayor Ed Lee did not respond to a KPFA request for comment by airtime. The nurses say they're still negotiating their contract to get special language ensuring sufficient hiring and resources to treat all patients properly.